Your doctor looked you in the eye last month and said you seem fine, but you have not felt fine in a very long time, and the question nobody is asking you is this: what if the signs of what you are actually going through do not look the way your doctor has been trained to look for them? Because for millions of older adults right now, depression is hiding in plain sight, and the people who are supposed to catch it are missing it, not because they do not care, but because depression in older adults looks completely different to depression in younger people. And most of the training, most of the checklists, and most of the 5-minute GP appointments are not built for what you are actually experiencing. Today, we are going to change that. We are going to go through the specific signs of depression in older adults that are most commonly missed, explain why they get missed, and give you the language you need to walk into your next appointment and be heard. Before we go any further, I want you to do one thing. Think of one person in your life, a parent, a partner, a neighbour, a friend, who has not seemed like themselves lately. Hold them in your mind as we go through this, because by the end of this video you may understand something about them that nobody around them has been able to name yet. Part 1. Why depression looks different after 60. Most of what people know about depression comes from how it presents in younger adults. Persistent sadness, crying, feeling hopeless, talking about not wanting to be here. These are the signs that medical training has historically centred, the signs that public awareness campaigns have focused on, and the signs that GPs are most likely to pick up on quickly. But here is what the research shows. In older adults, those classic presentations are often absent. Instead, depression in later life frequently arrives wearing a completely different disguise. And because it looks different, it gets called something else, or it gets called nothing at all. According to a major meta-analysis by Johanna Hagemann and colleagues, published in the British Journal of Psychiatry, older adults with depression are significantly less likely to report feelings of sadness or hopelessness than younger adults with the same condition. They are more likely to present with physical complaints, cognitive changes, and behavioural shifts that appear to have nothing to do with mental health. What that means in practice is that an older adult with clinical depression may sit in a GP's office and describe back pain, fatigue, poor sleep, and digestive problems, and leave with a referral to a physiotherapist and a prescription for a stomach medication, when what they actually needed was a conversation about their mental health. This is not a small problem. Research by Alan Mitchell and colleagues found that across primary care settings, clinicians miss the diagnosis of depression in older patients at a rate significantly higher than in younger patients. The condition is there, the suffering is real, but the presentation does not fit the expected picture, and so it passes unseen. Let us go through exactly what that picture actually looks like. Part 2. The signs that get missed and why. Drop a comment below right now with a simple number. On a scale of 1 to 10, how well do you think your GP actually understands how you feel emotionally? 1 being not at all, 10 being completely. Just the number. I am genuinely curious, and I think a lot of people watching this will relate to what you write. The first sign that is consistently missed is physical pain with no clear medical explanation. Older adults with depression frequently present with persistent aches and pains, headaches, joint discomfort, stomach problems, or a general sense of physical heaviness that has no identifiable physical cause. Because both the patient and the doctor are focused on the physical body, the emotional root often goes completely unaddressed. Research published in the journal Pain by Gregory Huskinson and colleagues showed a strong bidirectional relationship between chronic pain and depression in older adults, each making the other worse. Yet in clinical practice, pain and mental health are frequently treated as entirely separate problems. The result is that patients get pain management when what they also need is mental health support. The second sign is fatigue and loss of energy that is dismissed as aging. Almost every older adult who mentions tiredness to their GP will at some point hear some version of the phrase, "Well, that is quite normal at your age," and sometimes it is. But persistent, unexplained fatigue that does not improve with rest, that is accompanied by a loss of motivation, a reduced ability to enjoy things, and a general heaviness about daily life, is one of the most reliable indicators of depression in later life. According to research by Robert Baldwin, one of the leading geriatric psychiatrists in the United Kingdom, fatigue in older adults is so frequently attributed to the normal aging process that depression goes undetected for months or even years in patients who have been presenting with this symptom repeatedly. The third sign is irritability and anger rather than sadness. This one surprises a lot of people. We tend to associate depression with quiet withdrawal, with tears, with softness. But in older adults, particularly older men, depression often surfaces as irritability, short-temperedness, an unusually low frustration threshold, snapping at people they love, getting disproportionately angry about small things. Because irritability does not fit the cultural picture of depression, and because it can make the person less easy to sympathize with, it is frequently not recognized as a mental health symptom. Family members may assume the person has just become difficult with age. GPs may not connect it to mood at all, and the person themselves is unlikely to walk in and say, "I have been very irritable lately," because they may not experience it as something being wrong with them, only with the people and situations around them. The fourth sign is memory and concentration problems that look like cognitive decline. Here is one of the most important things in this entire video. Please listen carefully. Depression in older adults can cause significant changes in memory, concentration, and cognitive processing. It can make someone appear confused. It can slow their thinking. It can make them struggle to find words, follow conversations, or retain information they were told recently. These symptoms are so similar to early dementia that they are frequently either misdiagnosed as dementia or, perhaps even more commonly, dismissed with a wait-and-see approach while the underlying depression goes untreated. According to research published in the American Journal of Psychiatry, this phenomenon, which clinicians sometimes call pseudodementia, is both more common and more significant than is generally appreciated. The critical point is that when depression is treated, these cognitive symptoms frequently improve or disappear entirely. They are not signs of permanent decline. They are signs of an untreated mood disorder. If someone you love has been showing signs of memory problems, please make sure that a proper assessment for depression has been part of the conversation before accepting a diagnosis of cognitive decline. Pause the video right now if you need to. Write that down. It matters. The fifth sign is withdrawal from activities and social life, described as preference rather than loss. When an older adult gradually stops going to the places they used to go, stops calling the people they used to call, stops engaging with hobbies they once loved, the most common explanation given by the person themselves is, "I just do not feel like it anymore. I prefer the quiet. I am tired of going out." And on the surface, that sounds like a preference, like a choice, like someone who has decided to simplify their life. But in the context of depression, that withdrawal is not a choice in any meaningful sense. It is one of the core symptoms of the condition. The medical term is anhedonia, the loss of pleasure or interest in activities that previously brought enjoyment. According to the Diagnostic and Statistical Manual of Mental Disorders, it is one of the two defining criteria for a diagnosis of major depressive disorder. The reason it gets missed is that in older adults, this withdrawal happens gradually and quietly, and is often interpreted by everyone around them, including their doctor, as a natural and acceptable part of aging, rather than as a clinical symptom requiring attention. The sixth sign is changes in appetite and weight that are attributed to physical health rather than mood. Significant changes in appetite, either eating much less than usual or, in some cases, eating more as a way of managing distressing emotions, are a recognized symptom of depression at any age. In older adults, weight loss is frequently attributed to medication side effects, dental problems, swallowing difficulties, or simply reduced appetite with age. While all of those can be genuine causes, depression must be on the list. Research consistently shows that appetite and weight changes are among the most common and least recognized presentations of late-life depression, particularly because they sit so comfortably within a medical framework focused on the physical body. The seventh sign is expressing hopelessness or meaninglessness without using the word depressed. An older adult with depression may frequently say things like, "I do not see the point anymore. There is not much left to look forward to. I am just waiting now. Everything feels a bit grey. I do not know why I bother. These are not casual expressions of mild dissatisfaction. They are articulations of a significant mood state. But because the person is not saying, "I am depressed," and because the statements are often made quietly, in passing, almost as throwaway remarks, they are frequently not picked up on. According to research by Ken Laidlaw, a clinical psychologist who has spent decades working with older adults and depression, older people are far less likely than younger people to frame their experience in mental health language. They may have been raised in a generation that did not have those words. They may feel that using those words is dramatic or self-indulgent. So instead they say, "I just feel flat. I feel like the colour has gone out of things. I do not feel like myself." Those sentences are the ones to listen for. Part 3. What you can do with this information. I want you to take out your phone right now, or a piece of paper, whatever is nearest to you. And I want you to write down the name of one person in your life, including yourself if this video is resonating personally, for whom at least 2 or 3 of the signs we have just talked about apply. You do not have to do anything with that name right now, but I want it written down, because one of the things research consistently shows about mental health help seeking is that awareness is the essential first step. You cannot address something you have not named. So let us talk about what naming it looks like in practice. If you are an older adult watching this and you recognize yourself in what we have described, I want to encourage you to make a GP appointment this week. Not next month, this week. And when you get there, do not lead with the physical symptoms. Lead with how you have been feeling emotionally. Say something like, "I have not been feeling like myself for a while. I think I might be struggling with my mood. I would like to talk about that." Those sentences are specific enough to direct the conversation, and they are an entirely reasonable and legitimate reason to see your doctor. If your GP does not take it seriously or tells you it is just your age, you have every right to ask for a longer appointment, a referral to a mental health professional, or a second opinion. Depression in older adults is a treatable medical condition. You are not being dramatic by pursuing it. If you are a family member or a carer watching this, the most useful thing you can do is not try to fix it yourself. The most useful thing is to help the person you are concerned about get to the right support. Offer to go to the GP appointment with them. Help them articulate what they have been experiencing. And if they resist, keep the conversation open without pressure. Sometimes people need to hear something several times before they are ready to act on it. What was the most useful thing in this video for you personally? Go to the comments right now and tell me. Was it one of the signs we talked about? Was it the information about cognitive symptoms? Was it something you are now going to use in a conversation with someone you love? Tell me below. I read everything. Depression in older adults is not invisible because it does not exist. It is invisible because we have not been looking for it in the right places or with the right understanding. The signs are there. The person is struggling, and with the right awareness, the right conversation, and the right support, this is a condition that responds to treatment. People get better from this. People who have spent months or years in quiet suffering find their way back to themselves. That is not wishful thinking. That is what the research consistently shows. If today's video was useful to you, please share it with one person. Just one. Think about who in your life might need to see this. Share it with them. That act is more valuable than you know. Subscribe to Senior Mindwell if you have not already, and press the bell so you never miss a video. We publish every Tuesday and Friday specifically for older adults and the people who care about them. Topics the mainstream mental health world is not covering for your generation. We're here every week. Next on this channel, we are going to talk about grief after retirement, which is one of the most searched and least understood experiences for older adults, and specifically the grief that has no name, no card, and no cultural recognition, but is completely real. That video is on your screen now. Watch it next. Take care of yourself. You deserve to be seen. And today, I hope you were.